For the last fortnight, ITV News has laid bare the pressure our hospitals are under. And this morning, confirmation a super flu crisis is making matters worse, with cases still yet to peak.
The suspicion is that we're going to go up to around 6,000, maybe 8,000 patients in hospital at the very peak. Unfortunately, we don't yet know when that peak will come. So it is a very difficult situation, and it's difficult for the emergency care system, which has already been under pressure.
The number of people in hospital in England with flu has jumped by 55% in a week. An average of 2,660 flu patients were in hospital each day last week. At this point last year, that number stood at around 1,800 patients, while in 2023 it was just 402.
That was the line of trolleys that we passed.
That's right.
It's meant anyone going to A&E, even without the flu, faces grim waiting times.
It's very scary.
70-year-old Linda Whitby waited over 26 hours for a bed last week.
So nobody likes going to the hospital, but you should be able to go with confidence, knowing that they're going to look after you, and they should have the resources to look after you. And if they can't, well, what hope is there?
Linda, who has Crohn's disease, went to A&E with severe abdominal pain, a temperature and uncontrollable shaking. Her daughter says the waiting room, filled with cries, was the stuff of nightmares.
It was depressing, sad, I think lonely in one respect, lonely for a lot of people in there who had nobody with them, people on wheelchairs in drips and things like that. There was a man lying on the floor with his foot up, with his socks off, because there was nowhere for him to lie down. It's unacceptable.
The trust that runs Arrow Park Hospital in Merseyside has apologised and blames exceptionally high flu cases. The problem could be made worse still with the threat of strike action next week by resident doctors in a dispute over pay. Meanwhile, as they grapple with the super flu surge, A&E departments ask that people only come if they absolutely have to. And if they do, well, it could be a very long wait.